Welcome to Dr. Sushant's anatomy tutorial. In today's video, I am going to talk about the osteology of the humerus. We all know that the humerus is the long bone of the arm and it is the longest bone of the upper limb. Right? Here is the humerus of the left side. Here is the humerus of the right side. So it's a long bone. Oh, what is a long bone? Bone that has an upper end, lower end, and an intervening shaft is called a long bone. So the features of the humerus, I will discuss them under three headings: upper end, shaft, and lower end. So the humerus is the longest bone of the upper limb, right? And because it is a long bone, it presents three parts, that is the upper end, the shaft, and the lower end. Upper end, intervening shaft, and the lower end. First, let us talk about the upper end. So the upper end of the humerus, when you look at it, it presents some certain parts. Okay, so it consists of the head. There is greater tubercle, or it is also known as the tuberosity, the lesser tubercle, or the tuberosity, and then we have the upper part of intertubercular sulcus and the neck. So these are the parts of the upper end. Now let us look at these parts. Here. So here is the head. Alright. So head of the humerus, as you can see, is this part that articulates with the scapula to form the shoulder joint. So let me show you the head of the humerus. This part right here, that is covered by the articular cartilage. This is the head. So we see only one aspect of the head here, that's covered by the articular cartilage. Like in any joint, the articular surface is covered by the articular cartilage. So you can imagine a three-dimensional aspect of the head. So this part is the head of the humerus. Now let us look at the more details of the head. So let me isolate the bone and see. This is the shiny portion here. This is the head that's covered by articular cartilage. So the head is actually spheroidal in shape and it actually forms 1/3 of a sphere. And when you look at the direction, it is directed upwards, medially, and slightly backwards. And it's going to articulate with the glenoid cavity of the scapula to form the shoulder joint, which is a ball and socket variety of synovial joint. The joint is also known as the glenohumeral joint, this one right here. Now, this head, this white color you see covering the head, is the articular cartilage, which is a hyaline cartilage that does not have a perichondrium. And it is going to articulate with this cavity, the glenoid fossa, which is actually very shallow. And this shallow glenoid cavity is deepened by something called glenoidal labrum. So this glenoidal labrum, the structure that is covering this articular surface, the glenoidal labrum, is actually a white fibrous cartilage, right? And this actually deepens the cavity so that the head of the humerus can fit better. And because the scapula, the glenoid cavity of the scapula is shallow, wide range of movement is possible at the shoulder joint, but at the expense of it is not very stable because it is highly mobile. So at the expense of stability, there is greater degree of mobility. Now when we look at the long axis between the upper end and the lower end, when we overlap the transverse axis of the upper end and the transverse axis of the lower end of the humerus, we see that there is an angle between the two. Okay, this angle is called angle of humeral torsion, because when you look at the shaft, it appears to be twisted in one direction. Therefore, the upper end, the transverse axis of upper end, the transverse axis of lower end, they do not coincide with each other. In fact, there is an angle between the two, and this angle is called the angle of humeral torsion. You can make out this angle here. I can show better. This here is the, suppose this is the transverse axis of this end. This is the transverse axis of the lower end. Now there is an angle here, and this angle is known as the angle of humeral torsion, and it is about 164 degrees. Basically, the shaft is twisted so that the upper end and the lower ends are not coinciding. The long axis of them do not coincide. Right, so that's about the head. Now let us look at the tubercles. First, let us talk about the lesser tubercle. So where is the lesser tubercle? See these projections here in the upper end of the humerus. So this one right here, this is the lesser tubercle. So it is a convex projection on the front aspect of the upper end. And here we can see another projection, that's the greater tubercle. So the greater tubercle is on the lateral aspect of the shoulder. Right. Now this lesser tubercle is actually smooth, as you can see, and it receives the insertion of the subscapularis tendon here. Alright, now let us add the subscapularis muscle to see its insertion. So the lesser tubercle receives the insertion of which muscle? Subscapularis. So subscapularis tendon is actually inserted to this. See, right? So we have the subscapularis muscle here, taking origin from the subscapular fossa of the scapula. You can see that is the ventral aspect of the scapula, and it is inserted to the lesser tubercle. So the insertion of the subscapularis tendon may extend downwards into the upper part of the shaft also. Right. Now when you look at the lateral margin of the lesser tubercle, let's go back to this and remove the subscapularis muscle. Now when you look at the lesser tubercle, right, so the lesser tubercle has got this sharp margin here, this sharp margin of the lesser tubercle, and it is going to contribute to something. This is the margin I'm talking about, right? The lateral margin of the lesser tubercle, it is sharp and it is separated from the greater tubercle. Okay, so this area here in between the two, as you can see, in between the two, there is a shallow groove here. This is called the intertubercular sulcus, right? So this intertubercular sulcus has some contents. We will discuss the contents of the intertubercular sulcus in a bit. Now, so the point here is the lesser tubercle has got a sharp margin, and this sharp margin is separated from a sharp margin of the greater tubercle, that is on the anterior aspect of the greater tubercle. Between the two, there lies an intertubercular sulcus. And these two sharp margins, one of the lesser tubercle, one of the greater tubercle, they are attached to each other like this by something called the transverse humeral ligament. So let me show you the transverse humeral ligament. Here, look at this. This is the tendon of the long head of biceps brachii lying in the intertubercular sulcus. Okay. Now see this structure here. This is called the transverse humeral ligament. Now look at its attachment. It is attached to the two sharp margins of the lesser tubercle and the greater tubercle. This is the anterior aspect of the upper end. So the most anterior projection you see here is the lesser tubercle. Lateral projection is the greater tubercle. So the lateral margin of the lesser tubercle and the anterior margin of the greater tubercle are attached to each other by something called the transverse humeral ligament, and that forms a bridge over the intertubercular sulcus. And lying in the intertubercular sulcus is the tendon of long head of biceps brachii muscle. So these details we will elaborate here. So the lesser tubercle of humerus. Okay. So the lesser tubercle of the humerus is also known as the tuberosity. Is also right. Okay. Lesser tuberosity is another name. So it has actually got a smooth muscular impression. Okay. And the smooth muscular impression is actually for the insertion, that is important, insertion of subscapularis tendon. Okay. Now we have the lateral margin of the lesser tubercle that is attached to the anterior margin of the greater tubercle by a ligament called transverse humeral ligament. So this transverse humeral ligament bridges what is known as the intertubercular sulcus. So I believe you know why it is intertubercular, because it is between the lesser tubercle and the greater tubercle. Therefore, it is intertubercular sulcus, and lying in the intertubercular sulcus will be the long head of biceps brachii muscle. Okay, so that's the transverse humeral ligament. All right, and this long head of biceps brachii muscle, that is, you will see the tendon. Okay, the tendon of long head of biceps brachii muscle, and it will be covered by its synovial sheath. So this is kept in position by the transverse humeral ligament that is attached to the sharp margins of greater and lesser tubercles. I believe that is clear. Right here, this is the transverse humeral ligament. You can see this tendon is the tendon of long head of biceps brachii lying in the intertubercular sulcus, and it is kept in position by the transverse humeral ligament. Next, we will talk about the greater tubercle. Right? So greater tubercle is this projection. It is larger. Now you can see in this view that the greater tubercle is much bigger. This is the greater tubercle, right? Greater tubercle, and this is the lesser tubercle. So now we are going to talk about the greater tubercle. This greater tubercle on the posterior aspect presents three important muscular impressions. Alright, so these three muscular impressions are the upper impression, the middle impression, and the lower impression. And these impressions are present on the posterior aspect. Okay, so this greater tubercle or the greater tuberosity, it occupies the most lateral part of the upper end of the humerus, and it is convex on its lateral surface, and this convex lateral surface projects beyond the shoulder. So it actually contributes to the rounded contour. Okay, rounded contour of the shoulder. Right. So when you place your hand on the lateral aspect, that is covered by the deltoid muscle actually, so you can feel the lateral projection of the greater tubercle. Now when you look at the posterior surfaces of the greater tubercle, you can see these three impressions there. These three impressions are named upper impression, middle impression, lower impression. Okay, and these impressions are actually for muscles. The muscles that are inserted here are the tendon of supraspinatus. Okay, so here we have this upper impression is for the supraspinatus. This one right here. This is the supraspinatus. This is infraspinatus. This is for the teres minor. So the sit muscles. So these sit muscles, along with the subscapularis tendon, form what is called the musculotendinous cuff. That basically strengthens the shoulder joint, the capsule of the shoulder joint. Now let me show you these muscles here. Okay, let us add these muscles one by one so that you will understand what the musculotendinous cuff means. Okay, so I've added the subscapularis muscle. Now let me add supraspinatus muscle. So the supraspinatus muscle is attached to where? Supraspinatus muscle is attached to the upper impression of the greater tubercle, as you can see. Then I'm going to add the infraspinatus. Infraspinatus is attached to where? To the middle of the impressions on the posterior surface of the greater tubercle. Then there is one more muscle, that's the teres minor. The teres minor is attached to the lower impression on the posterior surface of the greater tubercle. Now see these three muscles here. Okay, and on the front we have the subscapularis, which is inserted to the lesser tubercle. So these four muscles together form what is called the musculotendinous cuff. So this musculotendinous cuff will reinforce the shoulder joint, right? See, the capsule of the shoulder joint is reinforced by these three muscles on the back. That is this one, supraspinatus, infraspinatus, teres minor. So I'd like to show you this individual muscles. Okay, this is the supraspinatus. You can see it takes origin from the supraspinous fossa above the spine of the scapula, right? And its insertion is to upper impression on the posterior superior surface of the greater tubercle. Next, we have the other muscle, that is the infraspinatus. This is the infraspinatus muscle that takes origin from the infraspinous fossa inferior to the spine of the scapula and is inserted to the middle impression on the posterior superior surface of the greater tubercle of the humerus. And the other muscle here, this tiny little muscle here, is the teres minor, which takes origin from the upper two-thirds of the lateral border of the scapula and is inserted to the lower impression of the greater tubercle of the humerus. Right? So these are the muscles that are attached to the greater tubercle. So what are the points that we should remember as far as the greater tubercle is concerned? So the greater tubercle, also greater tuberosity, it is actually much larger than the lesser tubercle. Obviously, that's why it's called the greater tubercle, and it occupies the most lateral part of the upper end, and it is convex, and its lateral surface is palpable, right? And it contributes to the rounded contour of the shoulder. And remember that it is covered by deltoid muscle, right? And it presents three impressions, right? And these three impressions are actually flat impressions, and they are present in the upper and posterior aspect of the greater tubercle. And these three impressions are named as upper, middle, and lower impressions. So the upper impression is for the insertion of supraspinatus tendon. Okay, the middle one is for the infraspinatus, and the lower one is for the teres minor muscles. So these three muscles, together with the subscapularis tendon, which is inserted to the lesser tubercle, forms what is called the rotator cuff, or also known as musculotendinous cuff, right? So this musculotendinous cuff is actually going to reinforce the capsule of the shoulder joint. So it actually gives additional strength to the shoulder joint. So which muscles form the musculotendinous cuff? Supraspinatus, infraspinatus, teres minor, and the subscapularis. So 6 muscles form the musculotendinous cuff or rotator cuff. Okay, what is supraspinatus, infraspinatus, teres minor? This one is subscapularis. These 3 are attached to greater tubercle, and this one is attached to the lesser tubercle. Right? Now, next, let us talk about the neck of the humerus. Okay, the neck. Right. Go back to the 3D. So, let us remove all the muscles and the connective tissue. Now, we are going to take a look at the neck. See, this is the neck of the humerus. So, the humerus basically presents 3 types of neck. Okay. So, one is this constriction here. Okay, this is known as the anatomical neck. Okay, that is immediately succeeding the head, meaning where the head ends, anatomical neck begins. There's another neck. This is the surgical neck. This is a constriction between the upper end and the shaft of the humerus. Right. Then there is a morphological neck. Okay, so the morphological neck, it lies about 0.5 centimeter above the surgical neck. Okay. It is not present in adults. This is actually the neck present between the upper epiphysis and the shaft of the humerus while it is developing. So 3 necks for humerus. What are the 3 necks of humerus? We have the anatomical neck, then we have the surgical neck, then we have the morphological neck. Right. So what is anatomical neck? Right. So anatomical neck is actually a constriction, okay, which is present between that between the not between that immediately succeeds the neck head, sorry, succeeding the so the anatomical neck, it immediately succeeds, okay, it succeeds the head. So the part that is actually a constriction succeeding the head, okay. Next is the surgical neck. So surgical neck is very important because it has an important structure related to it, and fracture of it leads to something very serious. So this is actually a constriction again. The surgical neck is a constriction, and this constriction is actually present between the expanded upper end, right? Expanded upper end of the humerus and the cylindrical shaft of the humerus. So it is a constriction between the shaft and the upper end. And the surgical neck is actually related to an important structure. It is embraced posteriorly. Okay, so posteriorly, the neck is actually embraced by the axillary nerve. Okay, this axillary nerve is accompanied by the posterior circumflex humeral artery. Okay, so the axillary nerve is related to posterior and related to the surgical neck. So if there happens a fracture in the surgical neck, it can result in the division of the axillary nerve. Okay, it may cause cutting of the nerve that may result in paralysis of the deltoid muscle. Okay, so when the deltoid muscle is paralyzed, the patient cannot abduct. So the abduction of the arm is affected. Okay, now let us look at the surgical neck. So this one here is the surgical neck. Now let us look at the axillary nerve related to the surgical neck. So in mostly in the inferior dislocation of the shoulder joint, the axillary nerve is injured. See, here is the axillary nerve, as you can see. It comes from the posterior cord of the brachial plexus. It winds around the shaft. Not exactly the shaft. I mean the surgical neck over here, right? So if there is a fracture here, so it is going to affect the nerve. So the nerve will get injured. This nerve is actually going to supply which muscle? The deltoid muscle. So the deltoid muscle will be paralyzed. Let's look at the deltoid muscle. So the deltoid muscle will be actually covering the, okay, you see it is covering the entire upper end is under cover of the deltoid muscle. So when there is a fracture here, the axillary nerve is injured, and this axillary nerve will be supplying the deltoid muscle. So the deltoid muscle becomes paralyzed. Then you cannot abduct the arm. You cannot bring your arm away, take your arm away from your body. That's the abduction. So the abduction is affected in fracture of the surgical neck of the humerus. So this is nerve, that is the axillary nerve is accompanied by an artery here, that is the posterior circumflex humeral artery. So this posterior circumflex humeral artery is a branch of the third part of the axillary artery. So posterior circumflex humeral artery. Let us look at this artery here. Okay, artery, this one right here, this is the posterior circumflex humeral artery. You can see it is going with the axillary nerve. Right, this is the surgical neck of the humerus related to axillary nerve and posterior circumflex humeral arteries. Okay. Next, let us talk about the right. Let us remove the fracture. Clear fracture. Done. Next is the the morphological neck. It is about 0.5 centimeter above the surgical neck, and it is actually representing the line, that is epiphyseal plate, between the upper epiphysis and the shaft of the humerus. In adults, it cannot be differentiated because what happens by the time the bone completely gets ossified, the morphological neck disappears. Now, when you look at the attachment of the capsular ligament, that is the capsule of the shoulder joint, it is basically attached along the anatomical neck. Alright, so this is the capsule of the shoulder joint. As you can see, this capsule of the shoulder joint is attached along the anatomical neck, and this is deficient. That is the capsule of the shoulder joint is deficient here, as you can see. This deficiency is for the tendon of the long head of biceps brachii to come out, because we know that the biceps brachii has got two heads of origin. One of the heads of origins is the long head. The long head of biceps brachii arises from the supraglenoid tubercle of the scapula, and it comes from inside the capsule, meaning it is intracapsular, the tendon of the long head of biceps brachii. So this biceps brachii muscle has to come out of the shoulder, the joint, because the supraglenoid tubercle will be inside the shoulder joint covered by the capsule. So here is a deficiency in the capsule for the tendon of biceps brachii to come out. Okay, and in the lower part, the capsule of the shoulder joint encroaches on the upper part of medial surface of the shaft. Right, about 1 centimeter, extends to 1 centimeter below the shaft, that is upper end of the shaft. Right, meaning a little below the surgical neck, we have the fibrous capsule.